Hello, everyone. We got a video today with Dr. Kristian Andersen. It's a different perspective from what we've had on here before. We want people to be able to hear all sides. I don't necessarily agree with him on everything, particularly on his longer-term projections on some of the items, but just want to give everybody an equal opportunity and then hear from both sides.
Well, we're here with a special guest today. I'm Miles Himmel, Communications Director for District 5. We've got San Diego County Supervisor Jim Desmond, and our guest today is Dr. Kristian Andersen. Doctor, I was looking, there's big words for your biography, so I was like, I'm going to let you introduce yourself. Give people your background.
Thank you. Thanks, Miles, and thanks, Supervisor, for having me on. Yeah, so I'm a professor at Scripps Research here in La Jolla, and I'm also the Director of Infectious Disease Genomics at the Scripps Research Translational Institute. And then further, I'm the Vice President of the Viral Hemorrhagic Fever Consortium and also lead two NIH centers that are focused on infectious diseases, immunology, as well as outbreak response. So many years spent, working on infectious diseases. I've worked in many outbreaks before: Ebola, Zika, Lassa, West Nile, as well as others. And now, of course, also COVID-19.
Yeah, see, that's why I let you do it rather than me, to give the background. Doctor, you kind of explained, and this is kind of the first question we've asked all of our guests, is how you kind of first heard about COVID, kind of where you kind of enter in the realm, and kind of where we are, if you can give people a background.
Sure. So we look closely for emerging outbreaks because that's a lot of what our research is focused on. So we heard as soon as we heard about the initial reports from China back in the very beginning of January. I think about January 1st was when we were alerted to a novel outbreak in China. It was unclear at the time what it was exactly, and of course pretty quickly after that it was confirmed to be a novel coronavirus. And then only 10 days after that, we had the sequence of the virus too. So we knew it was truly novel. We knew what it looked like. We knew how it was related to SARS and other coronaviruses, for example. So yeah, we've been in there from the very beginning, following the situation very closely.
What's your prognosis as to where we are right now? What is it? I mean, we've heard, obviously there's different realms. It's going to kill us all. It's not a big deal. Where do you fall into that realm?
So let me make it clear: it's not going to kill us all. The question is, though, how many are we going to let it kill us? Because the prognosis right now is somewhat grim, right? I'm not super optimistic about the situation we have in the United States right now. I'm much more optimistic about the situation in multiple other countries. Europe, Asia, of course, many countries have gotten this under control. The issue that we have right now is that we, have failed so far to bring it under control in this country. We have failed to bring it under control in San Diego and California, of course, many other states here. And that has me concerned because we don't want to let a really dangerous virus be in charge here. We want to make sure that we dominate that virus. We want to make sure that we crush that curve like other countries have done it before us.
Well, I'll ask the question then. What have we failed at in San Diego County? I guess it's the fact that we got more cases. Our hospitals don't really seem to be overwhelmed. And where's the failure point for the country and San Diego County?
Yeah, so I think San Diego did a lot of good stuff in the beginning, right? Also, as a call it California state, when we sort of realized that, okay, we see a big uptick in cases here, back when our testing was far less optimal than it is today. We said, look, we need to fully close down now, just to buy us a little bit of time to start to get things up and running that will allow us to try and control the virus. So we did that early on back in March, right? And that went well. Then the issue was that while that bought us time to do some of the things, right, we did get testing up and running, for example, but then we had other issues around contact tracing, case investigations, but generally speaking, these things were done well. But then on top of that, we said, okay, we're now confident that we have this under control before we had actually crushed the curve fully. Right. And then we started opening up things that we knew from other countries were really high risk, and we did that very, very fast. And then the issue was that as that curve started creeping up again, and we have to remember that initially we see this in cases, right? The way that we diagnose people, we'll see the hospitalizations come up later, and then we'll see the deaths catching up even later on, right? Just because of lags. As we saw this coming up, we did not react quickly enough in terms of getting some of these other things under control. Again, the bars, the restaurants, right? Moving things outside, or making sure that face mask usage is mandated, and all these things we can do to control transmission, right? That happened again, so we opened up too fast and too early, and that's what sort of got on our current trajectory. Now it's plateaued again, and of course we have closed down additional, again, bars, and we have moved restaurants and hairdressers and things that have moved outside, which I think is good. And we can hope that this is actually going to allow us to get some control again, but unfortunately we don't know that yet, because we have to, again, wait a little bit before we might see this in the case numbers.
Well, I got to tell you, one of the things is particularly, you know, in my lane, I'm in favor of opening up the businesses and getting things back. Bars, I think, were a stretch. I'll grant you that. Bars were a stretch, and I just, you know, had lunch with a group of people today where we all, you know, we're not in the family unit, but we can all sit around a restaurant table and eat. And, you know, it was outside, so we felt safe with that. But we have to live with this virus as well at the same time. And so the big pushback that I hear a lot is we've overreacted in some areas, particularly with schools. I hear that about schools. You know, the children are hardly affected at all. You know, in those that under the age of 17 in the statewide, no one has actually died from the virus. In San Diego County, no one under the age of 18 has died from the virus. So it seems to, you know, that we have, you know, we're kind of top heavy with people dying from the virus are elderly with underlying conditions. And, you know, I think the focus needs to be on absolutely protecting them, but also letting the workforce, you know, get back to work, and maybe not in those cases like bars and maybe even some types of restaurants. So, you know, what do you say to that, to the economy that's, you know, being hurt and people are being out of jobs, and the effect it has on them, not because of the virus, but psychologically, and having to deal with children now that aren't in school and things like that?
Yeah, so, you know, we all want the same things here, right? I totally agree with you that we need to open the schools. We need to get the businesses back to work, right? But the question is that we're facing some realities around the virus that we need to get past first. And I absolutely agree that we need to live with the virus, but there are different ways of living with the virus. There's the way of living with the virus that we do here in the United States. And then there's the way of living with the virus that you see in many European countries and Asian countries too, that have managed to force the virus down, right? So when we're talking about the economy and we're talking about the virus, it's not doing one or the other, right? It's not to control, to get a handle on the economy or getting a handle on the virus, right? It's to get a handle on the virus so we can get a handle on the economy. You've got to do one before the other, right? There's just no other way around it. And again, I'm hopeful that with some of these new things that we do, like moving dining outside, for example, moving many of our activities outside, which luckily we can do here in San Diego County, right? Because the weather is always perfect. So that is a really unique opportunity that we have here as San Diegans, right? And that's might enable us to drive the numbers down, where we can get back up with our case investigations, for example, which will help us control outbreaks, right? Right now, our case investigations is at 11%. It needs to be above 90%, right? So we can hope to control new transmission. So this is really critical, right? That we need to get those viruses while the new number of infections down. And once we do that, then yes, we start opening up in different stages, right? When we're talking about the children back in school, we're not necessarily just talking about personal health, the health of children. Of course, that is super important and we want to focus on that. But what we're also really worried about is that if we open up schools, that may lead to further outbreaks and much bigger outbreaks. And not only will that hurt the children because they're now at the risk of getting COVID, and even if they don't die from it, many of them can get very long-term consequences of infection, right? But it also run the risk of now we have many, many outbreaks that are being fueled in the community. So this is why we need to focus on population health as much as we need to focus on personal health. And this is where things like testing, surveillance, screening.
Well, isn't this also an opportunity though for as a society and lifestyle, most of the people that die from this, and I don't know, the statistics I see is that those under the age of 18 only have like a 0.25% chance of even of even getting the virus, because it's very, very low numbers for people under 18 to test positive, for the virus. It's a very, very small amount. But we as a society, the underlying conditions that a lot of people are dying from are diabetes, or or obesity, or hypertension, those types of things. Is it smart to focus on, our efforts on those aspects of our society and lifestyle to help combat the disease too? Because that seems to be, unfortunately, the target where the worst of the worst of this virus has been able to take hold.
Yeah, so I think, I think all life is important and critical, right? We need to protect all lives. And to say that, most people die because they're old or they have comorbidities, right? Yes, but they might still have 10, 20 years of a long, healthy, good life for them ahead of them, and now comes in COVID and takes them away, right? I think everything we need to do to prevent that. Yes, we need to prevent things like heart disease and diabetes too, but that's a much more long-term goal, right? Right now, it's the focus on the pandemic. And the pandemic here is, again, that yes, certainly elderly people with comorbidities are much more likely to die from disease. But what's really important to remember here too, and you're a numbers guy, right? Binaries. But the problem is that the outcome of COVID infection is not a binary. Either you survive or you die. For the ones that survive, there's a lot of these people that have really long-term health consequences because of the infections. Things like heart issues, things like lung issues. And we're only now starting to realize this and learning much more about how severe this actually is, right? And this could create many, 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 many long-term health complications for the people that actually survive disease, even young children, even young adults, and all of us.
Well, what do you, I guess you say that if they get the virus, they're much more likely to have longer term. So is this, I get my understanding, I'm not a doctor, I am a numbers guy, that this is really kind of the first time I've heard that of the longer term health effects. How do we know that, since we haven't even had this a year?
Yeah, so that's why it takes time to learn it, right? But if you look at some of the news, there's a study that came out in JAMA yesterday where they looked at, this was from Frankfurt, so from Germany, where they were hit a little earlier than us, right? Where they looked at 100 patients, normal patients, not specifically severe disease or anything, right? Just 100 patients that they randomly selected that were discharged from hospital with COVID. 80% of them, over the next following months that they have followed them, which is up to 4 months, had some heart involvement because of the survival of COVID. They had, ECGs that were abnormal. They were complaining about side effects and things like that. And these are not in old people. These are, young adults, normal adults like everybody else. And again, these were not even severe disease. There were hospitalizations, but they were not severe. They were moderate, right? So that's the really scary part about this. And we're only now learning about it because it takes time. As you're saying, like, how do we know this by now? Yeah, we don't, but we've started seeing it cropping up, right? And this is very, very different than, for example, flu, because flu, first of all, COVID is much more likely to kill you than flu, right? We're talking 10 to 50 times more likely here. But if we're just talking about flu versus COVID in terms of surviving the disease, is that for flu, you clear that, you're probably fatigued for a week or two or something like that. For COVID, you very, very, very often end up with this really long-term consequences of the disease. And the reason for that is that COVID infects a lot of internal organs. Again, your lungs, your heart, your kidney. A lot of places get hit by this virus that then will create these long-term effects. It's very similar to what we actually see from Ebola patients. They have these really, really severe, very long-term effects of the infection.
Well, I kind of question your 10 or 50% higher number of dying than the flu, because those
10 to 50 times the infection fatality rate. Yeah, if you look at the infection fatality rate of COVID, it's about 1%, right? Sort of between 0.6 to 1.2. If you look at seasonal flu, it's at least 10 times less than that. And potentially like H1N1, for example, it's about 50 times like that. Now, when people compare numbers, what we have to be really careful about is that the flu numbers in terms of infection fatality rates are modeling, right? It's based on modeling because for flu, we don't really have a good sense of exactly how many people have it. We don't really diagnose it very often. We don't test for it very much, right? So that's why we have to model it. But when we compare like to like with COVID versus seasonal flu, yes, the difference is at least 10 times, higher in COVID, just in terms of the infection fatality rate, and compared to some seasonal flu, maybe even up to 50 times more, 50 times higher.
Okay, but you have to kind of live with risk though as well. I mean,
Yes.
just getting out of bed or just living on this planet, there's risks. And so
Yes.
you have to kind of, as a politician, as a policymaker, I have to measure risk versus, the economy or people being able to eat and care for their children and things like that. So there's absolutely, so at what point, I get you say San Diego and the U.S. has failed. I don't know if I put it that, maybe we stumbled and we're making a correction, but to say we failed it's pretty harsh. And of course, nobody knows the perfect way to do this, this being all new to us. So what would you have done differently as far as opening up, or as far as would you have not allowed restaurants or bars, or everything goes outside right away? I mean, you got to kind of try some things and see what the result is, as opposed to doing nothing.
Yeah, no, so I agree with you. Let me just go back to your first point, though, in terms of failure, because yes, I also don't like to call this a failure, right? But I think it's important that if you, for example, let me ask you this question. If you look at the situation in Florida, you look at the situation in California, you look at the situation in Arizona, and you compare this to all European countries, Germany, Denmark, Norway, even Sweden, and other places, right? And certainly if we go to Asia and compare us to there, right, it's clear that here in the United States, we have many more cases, right? So while our whole response is not a total failure, there was nothing we could figure out here, right? The issue is still that we have a lot of cases, right? And there's no getting away from the fact that we have a lot of cases.
True.
Now, we got to live with risk. I absolutely agree with you, but we got to minimize that risk. And what's really important here is that we know things like testing, tracing, isolating, and quarantine, people that may have been exposed, or repeat testing them, for example. We know these things work to actually break transmissions and get the risk of getting COVID to get that really low. That's what other countries have done. And that's what I want to see too. And we can do it, right? We can absolutely do it. We just need to realize that that's what we need to do. And once we do that, then things like restaurants and bars, schools, other places where when we have a lot of cases in the community, it's really, really difficult to keep these things open. But we can choose to open them, but what we really need to focus in on is to keep them open, right? And we all want this. I want this. I miss going to restaurants, I miss going to bars, I miss going to all these places, and I look to my family in Denmark, and they're all doing it now because they got the virus under control. Right. So from my perspective, what I'm hoping we can do is to really, increase our efforts on things like testing, things like contact tracing. Everything that the county needs to get the case investigations up and running again, so we can break these new transmission chains as soon as they come up. Right. We have 20 outbreaks that were reported within a 7-day period. Right. We got to get that down to like single digits, like one maybe a week or so will be fine. Right. Once we have that. Okay. Yes, let's move restaurants outside, right? Let's move bars out. Let's move as much as we can outside to minimize risk, right? Absolutely, so they can remain open.
On the outbreaks and the numbers and how those are recorded, how those are counted, I guess. Right now, it's 3 outbreaks per institution, 3 people coming from different households, and it constitutes an outbreak. One of the things that kind of skews those numbers is you could have an establishment that has 6 employees or 600 employees, and it's still considered an outbreak, and they're counted that way. And another thing, we keep saying, there's number of cases. We knew, I guess we learned early, and maybe you confirm this or not, that a large percentage of the people have no symptoms of this virus, a large percentage. And so there's a lot of people out there that technically have, and they test positive, but they had no symptoms of the virus. And we're also focusing our testing right now on the first responders. We're focusing the testing on senior facilities, which we should be doing, and we're focusing it more on the more susceptible to the disease. We're focusing the testing. So those numbers somewhat, not entirely, skew the number of cases, but is the number of cases that bad, or is it the number of people that are being affected negatively that we should look at, or the whole picture? Because to me, number of cases is like, okay, what does that really mean if we're not looking at, well, what's the number of people that are actually negatively affected by it, or just have it, no symptoms? I'm not a doctor, so I don't quite grasp what that all means.
Yeah, so I mean, Jim, I totally agree with you that the ones that we are the most concerned about are the ones that are the most hardly affected by the disease from a personal health perspective, right? The issue is that when we're talking about population health, what we're worried about are people that can transmit the virus. And here, people that have asymptomatic infections are actually incredibly important in driving that spread. We know from several studies that probably between 50 to 60% of new infections come from people that are either asymptomatic or pre-symptomatic. So they're not quite displaying symptoms yet, but they will later on, right? And the issue is that if we have people like that out in the community and they don't even know they have COVID, but they go around and they can infect other people, that drives the case numbers up. And the more case numbers we have going up, the more people will be severely affected by the virus. It will make itself into, long-term healthcare facilities. It'll make itself into hospitals and so on and so forth. So that's why it's important that we consider everything. We consider new infections. And I just wanted to make one point really clear here, because we have Kelly Victory on for a few weeks ago, right? And she made the point that the numbers are, overcounted. We count patients too many times. It's just not true, right? First of all, San Diego doesn't do that. San Diego actually does. Even if I test positive twice, I only get counted once in the statistics, right? So that's really important. But what we also know is that when we look at seroprevalence studies and we see how many people were actually exposed to the virus, infected to the virus in a period of time, we know that the number of cases that we are counting is a lot less than the number of cases we actually did have. And this is really, really important, because if that wasn't the case, and you look at how many deaths we have in the United States, it's now more than 150,000, right? Versus the 4 million infections that we have, that's a very, very high case fatality rate if that was the case. But it's because there's all these people out there that we are not counting, right, who also gets infected, and they're not counted in the numbers. But when we see numbers going up, or we see numbers plateauing and things are at a high level, right, that is still very, very concerning, because the true number of infections is going to be higher than that, probably between 4 to 5 times higher, just based on what we have learned from these surveys.
Well, and just like you, for the different doctors and things that I talk to, I'm just trying to get different opinions. I can't vouch for what everybody says. But okay, so I hear. So try to explain this to me, because it's confusing. We want to get the herd. The herd needs the herd. What is it? The herd mentality, or the herd needs to get it. And once the herd gets it, then we'll have a better handle on it. So to me, the number of cases means the herd's getting it, and so is that not a good thing?
No, that is not a good thing, Jim. That is not a good thing. So there's been talk about, this was the Swedish strategy, right? Where we need to get herd immunity via infection. Okay. Here's the thing. So this is a very interesting concept, right? Because herd immunity is something that come out of vaccinology, right? This is something we reach with a vaccine. Once we have vaccinated a certain percentage of people, then we have herd immunity and the virus can't spread in that community. For SARS-CoV-2, we think this is probably around like 65% or so, 70%, right? Based on the effective reproduction numbers, we can calculate all of this. That's high, right? If you look at like how many people do we think have been infected in San Diego by now, for example, it's probably, I mean, I don't know, right? But it's probably around like 3, maybe 4%, maybe even 5%. you want to get that all the way to 70%, you have to assume that everybody who gets infected is now also immune, which we don't know if that's the case, and we don't know for how long they are, if they are immune either, right? If you do that assumption, it's going to take a very long time and a lot of cases with a lot of people dead because of the infection before we reach that herd immunity. So what we need to do is the vaccine trials look really promising, right? So what we really need to do is that until we have that vaccine that allows us to get to herd immunity, let's try and do as much as we possibly can for preventing infections, crushing that curve, getting those numbers down so we can open the schools and safely keep them reopened, right? So we don't have to close again. That's what we need to focus on, right? And then those vaccines will come in, and then we can reach herd immunity and we can hopefully eradicate SARS-CoV-2. Right? That is really what we're hoping. And of course, in that period of time, we're also going to get much better therapeutics that we can hopefully use to treat people from the infection. So the ones that will get really sick today and die for disease, we can save them with maybe a monoclonal antibody or some other therapeutic that we might develop in the meantime.
But if we, okay, I'm so confused. If we want to get to 70% herd immunity, 70% of the population has to have it. And if we're only counting...
No, 70% of the population has to be vaccinated, right? We do not,
vaccinated.
We can't. So this is really important. And I know there's a lot of confusion about this, right? By natural infection, this means going out there and getting COVID. There's no hope that we could reach herd immunity and in an acceptable manner, right? Way too many people will have to die for that to happen. Again, 1% of people that get infected will die from infection. Right? That is way, 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 way too many, given just the number of people that we have in San Diego County or given the number of people that we have in the United States, right? But this is why the vaccine is so neat, right? Because the vaccine, we can go in and we can vaccinate people, and that gives us to the 70%. And then the virus goes away, right? Which is what we all really want. We have eradicated it.
Okay. All right. Well, I'll tell you what, people are not going to listen this long, usually. So, Miles, you want to wrap us up?
Yeah, I kind of have two questions. I'll wrap it up, but you know, Doctor, it's fascinating to me that you speak with such conviction and such facts. Like you're like no, like and you totally get. If you could kind of step away from COVID, we've interviewed 4 or 5 other doctors, and they speak with the same conviction, and they would say this completely opposite thing. How come? And again, I'm not trying to make it personal. How come there's just so many different varying opinions?
Yeah, I think that's interesting. But when you look at people that work on infectious diseases specifically, if you look at the sort of early in January and February, and you look at like what would people working on infectious diseases saying, that message has not changed, right? It's still the same: test, trace, isolate, for example. We have obviously changed on the face mask usage, because face mask is something in the beginning we thought, well, you should wear that to protect yourself. And that's why people say it's probably not very effective at that. It actually turns out that it might be, right? But the belief was that it wasn't. So people like me were saying like, no, we should reserve that for doctors. But what we now know is it's because we thought about it wrong, right? We know that this spreads via aerosols. We know this spreads via droplets, right? So we have to wear a face mask so we can protect others. You need to protect people around you, right? So that kind of messaging has changed. But when it comes to like these really specific things that we need to, of course, we need to test for it. Of course, we need to trace people that might have been exposed so we can prevent them from transmitting, right? Of course, we need to isolate patients and treat them. We need to do these things. This is surely like, epidemiology that we do for any severe disease, and especially when it's a novel one that we know so little about, right? So I would say that message really has not changed, right? And again, a person like Kelly Victory is saying that the numbers are wrong because San Diego County counts them multiple times. Factually, just isn't correct, right? I mean, that's not how San Diego, luckily, because they do it really well over there, right? That is not how they counted. They only counted once.
Yeah. Okay. Last question, and we asked this to all the guests. So, a message for folks who listen to this, who certainly yours is a little more pessimistic, and that's not a bad, that's just how you feel. What is a message going forward? Good, bad? How do you feel?
I would say my long-term outlook is that if we can focus on getting this under control, right? Let's focus on how do we beat down that virus. The virus is in control right now. I don't want the virus to be in control. I want us to be in control. If we focus on that, right, and use the next month or two to really nail down on that virus, right, that's gonna put San Diego in a really good spot, right? Because we can do this, right? We can absolutely do this if we fully focus on that. And then again, the vaccine trials, the early stage drug that we see coming out, these are all extremely promising. The vaccine trials are more promising than I even hoped for, right? So we know that we are very likely to get some of these that will be available in the future. Probably not for most of us this year, right? But if we're really lucky, maybe early next year. And that will be a huge win, right? So we just need to get to there. And in the meantime, we obviously can't keep everything closed until we get there, right? That would be ludicrous. So we need to get that virus down so we can not only open up schools and businesses and so on, we can keep them open and we can keep them there. As soon as a new outbreak comes up, we go and we squash it immediately, right? That's what we really need to focus on. If we can really focus on that, and as individuals, staying out of big, congregations of people, wearing our face masks, doing things like that, can absolutely be done, right? I have no question about that.
All right. Well, thank you very much. We'll kind of end on that, Doctor. I appreciate your time and your effort and willing to do this. And I really thank you very much. Appreciate it.
Thank you very much, Supervisor.